I know that you will all want to know about the traveller from New South Wales, so I'll keep the vaccine part of this briefing very brief at the beginning. I do want to acknowledge that we did hit a very significant milestone. 1 million doses of the Pfizer vaccine have now been delivered in New Zealand. That includes 637,847 first doses and 381,517 second doses. District Health Board's tracking 7.5% ahead of plan. Last night I was advised by the Director General of a person who recently returned to Sydney from Wellington and that they had tested positive for COVID-19. The information that we have to date suggests that the case in question was likely to have been infected before they travelled to New Zealand and that the case is linked to the current Sydney cluster. I'll hand over to Dr. Bloomfield shortly for a detailed update on the case and the case details, locations of interest and contact tracing. But first, I do want to reassure New Zealanders that we've always had plans in place for situations like this, and that is what we are working through now. Our contact tracers are currently working at pace, and they have been since we were first notified of this case last night. The positive case, who is back in Sydney, was spoken to last night and again early this morning. The person's 4 close contacts were notified last night. They were put into self-isolation and they were tested first thing this morning. 2 results so far have come back from those tests. Both of those have been negative. Locations of interest were identified and published before 9 a.m. this morning, and they've been updated as more information has come to light as part of the investigation process. We're continuing to work very closely with the case and with the case's close context here in New Zealand to ensure that we have the information that we need for our own swift response. We've taken a very deliberate and cautious approach to pausing travel when there is community transmission in states in Australia. That cautious approach continues. Where cases can't be linked to the border or there are unanswered questions about their origin, we do impose a pause. So last night we made the decision to pause quarantine-free travel with New South Wales before we'd been notified of this most recent positive case, based on the information that we had to hand at the time about the current investigations around the outbreak in New South Wales. The pause came into effect at 11:59 p.m. last night. It will remain in place for 72 hours and it is under constant review. When the positive case left Sydney at the beginning of the weekend, there were just 4 cases, all with clear epidemiological links to the border. That number has since grown significantly. Today, ministers have been looking at further measures to reduce the possibility of transmission here in New Zealand. Even though we have no positive cases at the moment, we do know that we had a positive case and that person had some extensive potential exposure in the Wellington region. We just held a special cabinet meeting and out of an abundance of caution, the Wellington region will move to alert level 2 from 6 p.m. tonight, and that will run through at this point until 11:59 p.m. on Sunday. The rest of New Zealand will remain at alert level 1. For the purposes of this announcement, the Wellington region includes the Wairarapa and the Kapiti coast up to north of Otaki. Cabinet will review this again on Sunday. A reminder about what alert level 2 means. It means that there are limits on gathering size. Gatherings in the Wellington region are limited to fewer than 100 people. We know that gatherings do pose the biggest risk, and that includes weddings, birthdays, funerals, tangi, church services, and so on. Social distancing should be observed in public places. In retail stores, supermarkets, and clothes shops, there should be 2 metres of social distancing, and at least 1 metre in most other places, such as workplaces, cafes, restaurants, and gyms. The wearing of face masks remains compulsory on all public transport, but we're encouraging people to please also wear these when waiting for public transport and in taxis and rideshare services as well. We'd also encourage people to wear face coverings in any situation where they are interacting with people that they do not know and social distancing is not possible. Businesses can open, but must follow public health rules, including ensuring physical distancing, record keeping, and the cap on the number of people at 100. Schools and early childhood services stay open at alert level 2. Hospitality venues can remain open, but they need to apply the 3 S's: seated, separated, single server. If you're sick, please stay home, don't go to work or to school, and don't socialise with others. If you have symptoms of cold or flu, aches and pains, please call your doctor or healthline and ask about getting tested for COVID-19. Please keep track of where you have been at all times. This case is a very good reminder of our need to use the COVID-19 Tracer app and maintain an accurate record of your movements. People who were at locations of interest, who scanned in using the QR codes, will have been notified of those exposure events. While travel is not restricted under Alert Level 2, please remember to take the behaviours with you if you have been in the Wellington region over the weekend. For example, if you were in Wellington and you're now in Christchurch, please don't attend large gatherings. This will help to keep us all safe. This is the first time we have moved up to Alert Level 2 to manage the potential risk of COVID-19 in the community. This is not a lockdown. If we can all contribute and follow the health behaviours that I've outlined at Alert Level 2, we can break a potential chain of transmission. I want to reiterate that these are precautionary measures which will remain in place while we contact trace and test everybody that we need to. First and foremost, we want to ensure that New Zealanders are not unnecessarily exposed to COVID-19. So I'll now hand over to Dr. Bloomfield and then we'll open up for questions.
Thank you, Minister. Kia ora koutou katoa. So just a little more information about the visitor from Sydney who spent the weekend in Wellington, and then some detail around the public health response which swung into action last evening as soon as we were notified by our counterparts in Australia about this positive case who was identified in Sydney once they had travelled back there. So what we know so far is that based on the timeline of symptom onset and the CT value of the test, it is most likely that the virus was contracted in Sydney prior to the visit to New Zealand. Now, I would say we've learned this morning also that this person works in a healthcare setting that is very near the Bondi Junction, which is the focus of the outbreak in Sydney at the moment, and that one of the cases that is part of the current outbreak in Sydney had been seen at that healthcare setting. So there's a very strong epidemiological link, and we fully expect the whole genome sequencing results that are due back later today to confirm that this new case, the person who travelled here, is indeed part of that known outbreak in Sydney. The person has had the first dose of a COVID-19 vaccine. We know that, and that was about 10 weeks ago. Now, the case used the New Zealand COVID Tracer app frequently during their visit here, which is excellent, as did one of the other people who's a close contact and was with them most of the weekend. With their permission, we have already downloaded the data and we have started the process of sending out notifications. And of course, that was also allowed us to corroborate the information that the person provided on recall about where they had been and the times they had been there. Of course, our hope is that many people who visited those venues that are places of interest had also been using the app, and if so, they will receive a notification. However, that is complementary to the information that we now have on our website and that we have put out in media releases about the places of interest, the locations of interest. We now feel we've identified, based on the current information, all the locations of interest. There will be some more specific detail about one or two specific venues within Wellington Airport that we will provide when CCTV footage has been reviewed, but otherwise all the known places of interest are now public. It's a good reminder of the value of the app, and I can't encourage people enough, wherever you are in New Zealand, at any time, to use the app to keep a record of where you've been. At this stage, there are 4 close contacts, 2 of whom are located in Palmerston North and 2 in Tauranga. All 4 have been isolating since last night. The 2 who are in Palmerston North have tested negative, and we're awaiting the results on the 2 in Tauranga. However, what I would say is that the 2 people in Tauranga had a much more fleeting interaction with the case, a much shorter period of time with them. We're expecting those results back soon. The contact tracing team is also in the process of contacting 58 passengers who were on the flight that came into Wellington last Saturday morning, very early in the morning from Sydney, and they are working through the people on that flight. Many of those people will have been notified. They'll have all been notified last night and will be ringing Healthline directly, so we will be able to make sure we get in touch with all those people. Now, those people on that flight are considered close contacts, all of them, which means they are required to do the full 14 days in isolation and do the usual day 5 and day 12 testing. Just on the locations of interest, as I said, those have now all been published. So please, I encourage Wellingtonians and those who were in Wellington over the weekend to check that list and to see if they were at any of those places of interest at that time. If in doubt, to isolate and ring Healthline to get further advice if they were in any of those places. As a minimum, they will be required to be tested and remain isolated until they have returned a negative test. Some will be asked to isolate for the full 14-day period, and Healthline will be able to advise you on that. So we know the person stayed at the Ridges Hotel in Featherston Street, spent the weekend visiting various tourist and other places around Wellington and dining in the central city. They left Monday morning at 10:13 a.m. Most of the people on that flight will be followed up by our Australian colleagues. Some will have returned to New Zealand, and we're getting the information to make sure we can follow those people up as well. In terms of testing sites, here in central Wellington, the community testing station at 200 Taranaki Street is open, and extra capacity will be being brought on board there. Likewise, there is a testing site in the Hutt Valley. From mid-afternoon, there will be a further community testing centre at the ASB Indoor Stadium in Kilburnie, and most GPs and many urgent care centres will also do testing. So please check with Healthline. When you talk to Healthline, they will be able to let you know the closest place to get tested. I should say that whilst we have those 2 close contacts in Palmerston North, again, both have tested negative initially, there are no locations of interest or any particularly increased risk in Palmerston North or in Tauranga at this point in time. Finally, on wastewater testing, ESR will be carrying out additional wastewater testing today from samples taken yesterday at the Moa Point site, and we should have results of that tomorrow. And the other numbers from today, there are 4 new cases in managed isolation, and there were around 5,900 tests undertaken yesterday. And yesterday there were around 470,000 scans with the app. We need and want that number to increase, and I encourage people everywhere around the Motu to use the app to scan, because you never know when you might need that information. Thank you, Minister.
Just before I open up for questions, to foreshadow a couple of the questions I know that will come up, the Cabinet has also made the decision that government MPs and ministers will not be participating in large gatherings over 100 people anywhere in the country while this restriction remains in place in Wellington. Most government MPs and ministers have been in Wellington during this period of time and are in Wellington during this alert level change, and therefore we will take that with us wherever we go around the country. Parliament, I have spoken to the Speaker, Parliament will continue to sit today, but will be sitting under Alert Level 2 conditions.